Hi, Dr. Dave Webster, and this is the next video blog, and this one is about why I would advise the parents of a 16-year-old male with lymphoma to leave Ontario immediately. So I want you to keep in mind as you watch this video, in an August 2016 letter, Dr. Hoskins chastised me for not being concerned about radiation exposure from what CCO experts continue to insist is unproven technology. More importantly, perhaps, is that for sharing this information with you, Cancer Care Ontario has threatened me, and the College of Physicians and Surgeons of Ontario are investigating me. So this is presumably to protect you from me, the dangerous doctor. Now, this is how CCO standards of care for lymphoma patients would be currently in the province. And we are forced to follow this as physicians, and you can see the consequences when you challenge Cancer Care Ontario and the government with their standards. So, unfortunately, in December of 2017, a 16-year-old male presents with a very large painless mass in his neck, and in this age group, it's almost certainly going to be a lymphoma, a cancer of the lymph nodes, your tonsils, for example, or lymph nodes. Now, although one could argue that it would be reasonable to get a diagnostic CT with contrast with high radiation dosage to the patient, but consider the following. Now, he had to have a CT of his neck, chest, abdomen, and pelvis, and this is what I'm going to say is a coronal CT slice of the neck, and this is what we mean by the coronal plane. This is the patient's trachea, for example, the shores, and these are the lungs here, but this is the mass that you could feel in his neck, and the CT shows great anatomy, and that's consistent with that. It also showed some masses in what I'm going to call the mediastinum, and the side over here is normal for comparison between, this is muscle here actually, and this is the tumor here. Now, by his CT, he is staged as stage 2 out of stage 4, and clearly this would be a better prognostic stage to be in, and would dictate how he would have therapy and subsequent follow-up. Now, remember, he's only allowed to have his PET CT after his diagnostic CT. Now, remember, what a PET shows uniquely from a CT is it's a functional image, effectively. We're looking, this is a picture really of human cells and cancer cells, in fact, that are eating sugar because that's what they live on. And it's a very small dose. There is radiation associated with this for sure, but what about the information we get in return? So this is the patient's brain, heart, and bladder, so we'll ignore those for the moment. But this is the original finding on the CT. So here's this mass here, here's the, you can see very aggressive eating. This is a very aggressive cancer, as you can see. This is the finding here, and in addition, the CT also noticed these findings here. However, it didn't identify some findings. Now, this is just around the area of your clavicle here on the left. Actually, that's my right, there's your left. But anyway, the point is that actually wouldn't matter greatly, at least at this point in the staging, because it still wouldn't change the stage from stage 2. However, there were some very, very critical findings that the CT couldn't possibly pick up, because it simply can't possibly pick these things up. But this shows the cancer cells, however, eating sugar are identified, as you can see in the spine here. Now, the reason we are suspicious and know that is because normally this is the liver here, and the amount of activity in the bone marrow should be significantly less than the liver, and it's not. Now, the implications for the patient, besides changing his stage and prognosis, is that he did not have to undergo a painful biopsy of his bone marrow, where they stick a needle through the bone and extract those cells and look at them under the microscope. It has some risks associated with it as well. It also shows involvement of his spleen. So in reality, what the PET scan, in fact, appropriately showed was that he had a stage 4 lymphoma. Very different, the implications are very different, of course, for this patient with a stage 4 and how he will be treated in management. But what is clear is that he was, yet again, another patient was misstaged by his CT, which was compulsory, remember. So I'm going to show you an example of a finding on an FDG PET CT, which is missed on diagnostic CT. Now, this is a transverse slice of the chest, in fact. This is a transverse slice of the body, but you can see the sternum up here. This is the left lung. Now, this white stuff here is contrast in the blood vessels, and again, this does have some risk associated with it. Some people have allergic reactions to it and so on. But let's go on from that. The point is that what the PET CT showed was that this little, it's a lymph node actually called a retrosternal lymph node. It was not reported on the original CT, but again, it would not make a great deal of difference in the staging, but you'll see how it makes a difference in follow-up. Now, on the other hand, here's the PET image of fused PET CT. This is the CT, as you can see here. This is the PET. These are the cancer cells eating sugar. Makes it very clear. These are some other sites in the mediastinum. But just of interest, you see this is the diagnostic CT with contrast, and this is our low-dose CT without contrast, and you can see that there's not a great deal of difference. Now, both have radiation associated with them, and we're not to dismiss that, but the point is what kind of useful information do we get by adding the PET part of it, the FDG PET, and how many follow-up scans ultimately do they need, and that will be one of the key issues. So the question I'm asking to Cancer Care Ontario, the College of Physicians and Surgeons, and especially Dr. Hoskins, was the reason this young 16-year-old male had to have a high radiation dose diagnostic CT with contrast before he was allowed to have a PET CT in Ontario, and what would those reasons be? So, the treatment of this young man, he'll typically have 6 cycles of chemotherapies, which of course are poisons to all cells. But what people in the rest of the world who have been following patients' treatment responses with FDG for years, what they realized a long time ago was that for some patients, the toxic chemotherapy can be stopped after sometimes as little as 4 cycles if the patient's PET CT is negative. Now, the reason is because to continue these chemotherapy is actually now carries more risk to the patient than the actual cancer itself. So, but because this young 16-year-old male has the misfortune of living in Ms. Wynn's evidence-based Patients First Ontario, he has to have, at the 4-cycle mark, another high radiation dose diagnostic CT with contrast before he can even be considered for an FDG PET scan. So this is from a previous video I did on the impact on patients. This is not this patient, but this is his pre-therapy scan. These are, again, mediastinum. This is lymphoma in this patient's chest before he has therapy. So now he's had 4 cycles of chemotherapy, and look, there's the CT, really unchanged. And in fact, at 4 cycles, it would be very unlikely there would be significant changes on the CT. So the question begging, of course, for this patient is, that 24-year-old male, is, do I need 2 more cycles of this toxic chemotherapy? It is absolutely impossible to tell from the CT. However, this is the patient's pre-therapy PET scan. There's the cancer cells up there eating the sugar. This is 4 cycles later. So does this 24-year-old male need 2 more cycles of toxic chemotherapy? What do you think? He lives in Ontario, doesn't he? So the ongoing follow-up now of this patient, from now on he will only be allowed to have CTs. He will only be allowed to have an FDG PET CT if his CT is inconclusive. Now, yeah, we know, I mean, it's simply the reality is that CT scans have almost no ability to determine if there are persistent masses. Is this mass just scar tissue or active or recurring cancer? Obviously a major difference for the patient, isn't it? Now, unfortunately, given his young age, he will follow the example of a patient of mine who's had 22. I've had patients who've had as many as 30 and counting CT scans. But in this particular case, the only time any treatment decisions were made in this particular patient with 22 CT scans at that point was when he was graciously allowed 3 PET CT scans from the Government of Ontario. Now, I also have a colleague in Toronto, and this happened to a 17-year-old patient of hers, unfortunately, just a year ago. But what is the reality for these young people with cancer living in Ontario? Well, the good news is that they will have a good chance of surviving the lymphomas, given we've got some remarkable therapies. However, they will both have a significant increase in their risks of actually developing another cancer, and that's from the exposure to radiation. But wait a minute, they're not actually being treated with radiation, are they? That radiation risk comes from their compulsory diagnostic CT scans that they will receive on the Cancer Care Ontario standards. So, in fact, this young woman's physician will need to start screening her in the next couple of years for thyroid and breast cancer because of the anticipated risks from her high radiation dose diagnostic CT scans. So, now, to have your child develop cancer is any parent's worst nightmare. I'd ask you to just take a moment here and just think about what it would be like if your teenage child or somebody had this develop, or somebody you were really close to had this, and the fact that you live in Ontario and know this information that has been deliberately done to the patients of this Ontario, and thus why there's been such unprecedented accusations since 2005 against the Ontario government experts. So, remember the statement I made. Why would I advise the parents of a 16-year-old with lymphoma to leave Ontario immediately? Well, first of all, to have their children get access to the actual current world standards of investigation and management of their cancers, but more importantly, to simply protect them from the Ontario government and their CCO standards of compulsory care. Now, in my next video, I'm going to talk about why have Canadian and international experts condemned the Ontario government, medical experts, for what have been officially motions passed calling them unethical, and a senior member of the government finally resigns and says they're bordering on immoral acts against Ontario cancer patients. And one further question I'm going to have you consider. Just what is it that the Liberal government has against women with breast cancer in this province? So see you in the next video. Let's do something about this. Thank you.